So welcome everyone to the Society of Thoracic Surgeons Congenital Heart Surgery Database monthly webinar. Today is Tuesday, April the 29th, 2025. And as we talked about today, we are going to tackle our STS Data Manager survey. So thank you everyone for joining today and participating in the survey. We greatly appreciate it. As far as agenda, I've got super brief STS, and Leslie has one education update, and then we'll hop right into our data manager survey. Excuse me. So we'll have lots of polling questions. So be ready to get those your fingers ready for some polling. All right. So for AQO 2025. We have new dates. I know I'm sure you all probably received the communication that was sent out from marketing, but we do have new dates for AQO 2025. Unfortunately, we had scheduled the initial meeting. The initial dates were during Yom Kippur. Total oversight and complete accident on STSs on our part. We did not intend to do that. So we do have our new dates for AQO. Our new dates are a week earlier. So the conference is going to be held September the 25th and 26th. Same location, same hotel. Will still be in San Antonio, Texas at the same hotel. Will be at the Grand Hyatt San Antonio Riverwalk. And again, our CHSD session and GTSD sessions will occur at the same time. They will be held on Thursday, September the 25th. Our ACSD session will be Friday, September the 26th, and then our Intermax and PDMax session will be virtual, and that will be Tuesday, September the 23rd. We are currently accepting abstract submissions. So the deadline for abstract submissions is Monday, June the 2nd at 11:59 p.m. Eastern Time. And there is a link here to all of the abstract submission information and guidelines. So please get those abstract submissions in. We'd love to have abstracts for CHSD this year at AQO. Next, just a friendly reminder of our networking opportunities. We do have our STS Data Manager Facebook group page. We'd love to have you join. I think at last check, we're over 455 members. I'm not sure how many we're at, but again, that is for all data managers. Actually, right now we are up to 471. So feel free to join our Facebook group page for some networking opportunities. We'd love to have you join, stay up to date. We post in there frequently about upcoming webinars, releases from STS. So just be sure and join and check us out. We also have the STS Data Manager Collaborative, formerly known as the Data Manager Mentorship Program. And this pairs data managers who are seeking advice related to data abstraction. And then there are some STS regional groups. I think this is mainly adult cardiacs, and our regional groups offers a collaborative networking environment for peer-to-peer support and non-clinical guidance related to abstraction across specific regions. So be sure and check out these networking opportunities. Next, there's just a super brief update from Leslie for FAQ notes. So Leslie?
Yeah, thanks so much, Leanne. Hi, everyone. This is just after a couple emails we got over the last month-ish about FAQs and older versions of FAQs and training manuals. So just a quick reminder that the only manual for CHSD right now that we're looking at is the version 6.23 training manual, which you are all aware updates monthly. It is not appropriate to go back to previous training manuals and use those FAQ responses, nor do we want you to use like the adult training manual to answer questions or thoracic or other registries definitions to answer CHSD fields. Just a quick note for everyone, if you care, or just for your information, the FAQs from a previous version are all reviewed at the time of upgrade, and we use that to then improve or clarify our definition. So if something didn't make it in, there was likely a reason. So if it's not in the current training manual and you still have a question or are in doubt, submit a new FAQ. And then on that note, I received a few emails over the last couple of weeks about medication lists, and if we were going to be providing medication lists for things like our preoperative factors for coagulation disorders or post-operative events like the arrhythmias requiring drugs treated with drugs. I can't remember We will not be providing those lists. Number one, we could come up with a list today and tomorrow there'll be a new medication. But most importantly, we really want you to review the whole clinical picture, what's going on with your patient. We're really intending this to be they are on a medication for the purpose of anticoagulation, and they have labs that support that. So if you're in doubt and you're unsure if the medication really affects a specific lab, talk to your clinical team, use Google, submit an FAQ, but we will not be providing a published list of medications for any of those fields. So that's all we have for today. We'll be back with our more expansive education next month.
All right. Thank you, Leslie. Before we hop into our data managers, I saw Jen's got her hand up. So, Jen, did you have a question? Really quickly? Don't know, your hand was up. You may have to unmute yourself if you didn't, you had a question or not. Okay. All right. So let's go ahead and hop into our data manager survey and then we'll tackle questions at the end. All right, so everyone, our first question for today's survey is, what is your background? APN, health information management, medical records, IT, non-medical, other clinical, other physician, perfusionist, QI, non-medical, RN. About 61 people have responded. All right. I think we can go ahead and Nancy. All right. And so the majority are RN, 69% of you. And then followed up with APN, health information, IT non-medical, or clinical, a little bit of everything. So thanks everyone. All right, our next question, who do you abstract for? Do you abstract for a data abstraction company? Do you specifically abstract just for a hospital? Or do you happen to do both? I wish you could have some background music, but we can't. I got in trouble for that before. So just pretend like you hear the Jeopardy theme song in the background. All right, I think we can go ahead and stop, Nancy. So 87% of you abstract just for the hospital, and then we have 6% data abstraction, and then 6 also for both. I think I know who most of those 4 are. All right, thank you, Nancy. Our next question, how long have you been abstracting? Less than 1 year, 1 to 2 years, 3 to 5, 6 to 9, or 10 years or more?
Yeah, and we forgot on this one, I think we missed the 2 to 3 year mark. So that would be
Yeah.
included in the 3 to 5. It should be 2 to 5 years.
Oh, thanks, Nancy.
Yeah,
Carol.
and then it would be 5 to 9.
Yeah.
Or 9 to 10. Okay.
Whoopsie.
Whoopsie. We missed this like the last 2 years, I think.
Yeah.
If this doesn't apply to you, you can skip the question if you're not an abstractor.
Yeah. All right. So perfect. So we have some newer data managers that have been abstracting for less than 1 year, 13%, and then 1 to 13. 10 years or more. We've got about 30%, 18 of you. So wow, our seasoned veterans. So thank you all. All right. What was your previous experience? Clinical cardiac surgery, CV or CVICU, perfusion, clinical non-cardiac surgery, cardiology, non-cardiology, other medicine, medical admin, non-clinical and not in healthcare, non-clinical but within healthcare. All right, looks like our numbers have slowed down. So the majority of you are clinical cardiac surgery, followed up by clinical non-cardiac surgery. And then we have our non-clinical, but within healthcare, and then non-clinical, not in healthcare. All right, what are your work responsibilities? STS CHSD only, the STS database and other clinical responsibilities, STS and other cardiology databases, STS database and other non-clinical responsibilities, STS database, other surgical databases, or other I do not abstract. All right, we've got the majority are STS and other cardiology databases, 42%, followed up by the STS database and other non-clinical. And then STS CHSD only, we tied with STS and CHSD other surgical databases, and then we have some that do not abstract. Okay, our next, for which database do you abstract? CHSD, CHSD ACSD, CHSD GTSD, CHSD Intermax, CHSD ACSD, GTSD, all three major databases. Then we have all four databases, ACSD, CHSD, GTSD, Intermax, PDMax. Then ACSD, CHSD, GTSD, Intermax, and PDMax. Goodness gracious. I could not imagine having to do all of those databases.
There's somebody that does all.
Oh my goodness.
And I
I'm,
think we should add on here CHSD/PDMax.
yep, I just saw, that's what I saw that, yeah.
If that's what you do and you haven't coded anything already, you could probably just choose the CHSD Intermax and we'll
Yeah.
consider that just CHSD
It's
and
just the
PDMax.
PDMax, yeah.
So we're always improving upon our stuff, Leanne, aren't we?
We are. We learn every single day.
Every day.
Every day.
So humbling.
Isn't it though?
Yeah.
All right. Okay, Nancy, it looks like, but yeah, the majority are CHSD only, which is, I have mad respect for you all in the job that you do because it is extremely complicated. Followed up with CHSD and that one poor person that does everything. Bless you. All right. Our next, what is your assigned participant role in the STS National Database? You're a backup contact, primary. Do you serve both roles or are none of the above? Oops. I think you accidentally shared your screen, Dr. Meyer.
Uh-oh,
That's-
sorry.
No, it's okay. I can hijack it right now.
Good, please do, yeah.
Good job on that QR code though.
Yeah,
Yeah, well, that's what I was trying to
Yeah.
figure
that's
out.
impressive.
I'm a little slow.
No,
All right.
no.
Just hold your phone up to it and it'll go.
Oh, really?
Yeah.
All right. So it looks like the majority of us are the primary data and file contact and followed up with the backup. And then we have some both that serve both roles and then some that have neither of those roles. All right. So how many people abstract at your hospital? How many data abstractors, that's, I think I just created a new word, abstractors do you have at your institution? Let's see. So data abstractors for congenital, yeah, so we're speaking, all the questions that we're asking here are specifically just for the congenital database. So if you participate in other databases, all of these questions are specifically for the congenital database. Should we restart the poll? Can we redo that one, Nancy, just so people have the ability to redo, to re-answer that one?
Want me to get it?
One moment.
I
Yeah.
got it. I got it.
Oh, you got it? Okay, yeah.
Got
so-
it.
Yeah, so how many people abstract at your hospital for CHSD only? Sorry about that. But good questions, guys. Sorry about that. So what if we utilize an abstraction company in addition? So,
I think I would say how many people are assigned if you have a contract with the abstraction company. Maybe you know how many people are assigned to that abstract for
Yeah.
CHSD.
it looks like, yeah. We'll give a few more seconds here. It's like our numbers are still going up. And you also have staff surgeons, PAs, et cetera. Yeah, if they abstract, I mean, how many people do you have abstracting? All right, I think we can stop it, Nancy. So the majority are just one abstractor, followed up with 2, 3, 4, and then we have about 5% that have 5 plus. Impressive. Nice. All right, our next question. So again, this is CHSD only. How many cases do you abstract per month? Less than 5? 5 to 10? 11 to 20? 21 to 30? 31 to 40? 41 to 50? 51 to 100? 101 to 200, 201 plus. Total cases, Brooke, this is all cases, not just index. This is how many total cases do you abstract per month? I think we can stop it, Nancy. So it looks like the majority are doing 11 to 20 cases per month, followed up with 21 to 30, and then 31 to 40, 41 to 50. We have 51 to 100. Goodness gracious, 100 to 201, 201 plus, less than 5. All right, our next question. On average, how many hours does it take to abstract a case? So on average, I know we have a few, like adult cases can be a little long, but on average, how long does it take you to abstract a case? What is considered complete for abstraction when there's so much follow-up?
Mhm.
Chas, Leslie, what are your thoughts?
Maybe just through discharge for this
Discharge.
average, and then
Yeah.
there's probably an additional amount of time we all go back to follow up at 30 days, 1 year, etc.
Yeah. But just, yeah. All right, so let's go ahead and stop this one. So it looks like on average, it takes 1 to 2 hours for the majority, followed up with 3 to 4, less than an hour, and then 5 to 6. All right. What is your timing of abstraction for a case? Do you do the majority of your abstraction within real time? Within 1 week of your OR, 1 to 4 weeks, greater than 4 weeks after your OR date? So what about after discharge? We'll add that. Yeah, we'll add after discharge. So the majority of your abstraction, when do you typically start it, or when do you do it? Begin your abstraction? So it looks like, I think we're getting answer. It looks like a majority of the people, of data managers do 1 to 4 weeks after the OR date, followed up with within a week. Some do real time, and then greater than 4 weeks after the surge date. How many cases per year does your hospital perform congenital database? On average, how many cases per year does your institution perform? Ready? Looks like we can stop this one, Nancy. So the majority are 201 to 500, followed up with 101 to 200, 501 to 1,000, 51 to 100, 0 to 50, and greater than 1,000. Impressive. All right. Next question. Do you utilize a third-party abstraction company? Yes, no, I do not work at a hospital. All right, I think we're good. So 88% do not. We have about 8% on the call that do, and then a couple are not working at a hospital. All right, so what source do you collect data from for abstraction? Do you collect on paper, scan medical records? Do you use EHR, or do you do a combination of both? right, I think we accept. So a majority are just EHR, and then we have about 31% that do both. And then we do have some that still collect paper, scan medical records. All right, our next question, how do you abstract data? Do you directly to your vendor software or DDE site? Do you go from paper electronic form and then to your vendor software or DDE? All right, I think we're good. So 82% are directly to vendor software DDE, and then we have 18% that do paper to vendor software DDE. All right, our next question, is there a process in place for tracking patients post-operatively discharge? Does a process mean I just manually keep looking? It's a good question, Brooke. Do you have do you follow up? Do you have a process that you follow to follow up with patients post-operatively or discharge? That's part of your process, then you have a process. So it looks like the majority of you do have a process in place for tracking post-op and discharge. All right. Our next question. Does your surgeon fill out the pre-op factors or intra-post-op events sections of the data collection form? Yes, they fill out the pre-op factors and intra-post-op events. Yes, they fill out the pre-op factors. Yes, they fill out only the intra and post-op events. Or no, they do not fill out any portion of your data collection form. Surgical PA, that would count. I would count that as your surgeon, as a surgeon. I think. Yes, I would include that. So you don't have a DCF. Does your surgeon input the pre-op factors into your software? If you don't have a paper data collection, does your surgeon input any pre-op factors, procedures, or any pre-op factors or post-op events? So if they fill out the operative details, Amy? I'm trying to hold on, let me see what my next question is. I would answer yes to the operative event, the first one, Amy. Yes.
Hey, Leanne, we can clarify in a future survey, but I think that intra/post-op event was just meaning like the end of the event, the intra/post-op events table that took the place of complications.
Yeah.
Not meaning like intraoperative details.
Yeah.
Okay.
Thank you.
Yeah.
Like we said, learn every day. Thank you. All right, we're good. So yeah, so 7% said yes. They do the pre-op and the intra post-operative events. 3, yes, they fill out pre-op factors. 8% fill out the intra and post-op events only, and then for the majority, they do touch any portion of your data of your DCF, entering any of the data. Next question: are your surgeons available to answer questions from data managers? All right, we can go ahead and stop this one. So yes, so 98% of you, your surgeons are available, which is excellent. And then we have a small percentage of your surgeons are not available for to answer any questions. All right, so our next question: how often do you meet with your surgeon leaders? Daily, weekly, monthly, quarterly, or I do not meet with my surgeon or surgeons? Jen, you meet biannually? Okay. We can go ahead and stop this one. So the majority do monthly, quarterly, weekly, do not meet, daily, or and then Jen added she meets biannually. All right. Do you review your data with your surgeon leader before harvest close? So before you submit your final file, do you go back and review your data with your surgeon? I think we can stop this one, Nancy. So about half and half. So 54% of you do not meet with your surgeon or review your data prior to harvest close, and about half of you, 46% of you do. So yeah, so a high level of review counts. Like, do you review any of your data with your surgeon before harvest close? Okay. Next question. Do your surgeons review the CHSD spring and fall reports? Yes or no? So that can be, do they log in and look at the report specifically? That could be, do you share part of the report, send them a PDF? Do they look at any of the results from the spring and fall harvest reports? I think we go ahead. Yeah. So, which I expect a majority, 98% of you, yeah, your surgeons do look at these reports, and then a small number do not. Audit. Let's get on to the topic of audit. Has your site ever been audited by STS? Yes, no, or not sure. All right, so we have about the majority, 80% yes, 6% no, and then 15% are you're not sure if you guys have been audited or not. All right, next question. Do you perform internal audits on your GTSD data? Yes, no, unsure. All right, I think we're good, Nancy. So 72% yes, you do perform some sort of internal audit. 24% no, and then 4% were unsure if you all do some sort of internal auditing on your STS data. Next question, have you utilized your STS data for quality improvement projects? Yes, no, or unsure. All right, I think we can go ahead, Nancy. Looks like 66% of you have used your STS data for QI projects. So 13% are no, you have not, and then 21% are unsure. Alrighty, our next question, we're gonna rate some questions for STS. So rate STS's communication over the last year. Excellent, pretty good, average, or poor. All right. I think we're good. So that looks pretty good. Let's see, the majority said we were doing pretty good, followed up by excellent, average, and thankfully there's nothing, no one said poor, so thank goodness. So I'm glad that sounds very good. Of course, we want to get those averages up to pretty good or excellent. So if you have any input, just please feel free to reach out to me directly. Do you find the monthly webinars helpful? Yes or no? All right, I think we can go ahead and stop this one. So yeah, the majority, 98%, 2% said no. So if you don't find them helpful, please, again, feel free to reach out and let me know how we can improve that and make them helpful to you. Do you feel you have the resources to do your job correctly? So yes, the resources are good, or no, need more training opportunities. I think we're, oh, sorry, keep going. Every time I say that, no, you're good, Nancy. Every time I say that, the number goes up just one more time. So the majority say yes, the resources are good. And then we know need more training opportunities. And we are working, I know we kicked off, we've done one data manager training webinar. We'll be working on additional training webinars, but there's always have room for more training. So thank you. Next, how do you utilize the CHS training manual? Do you review it daily, monthly, still have questions? Daily, monthly, answers your questions. You review it prior to submitting an FAQ, or what is the CHSD training manual? This training manual stays open on my laptop, my desk at all times. I cannot function without it, and I don't even have to abstract a case. Think we're good. Yeah, so we're about half and half. You review it daily and still have questions, review daily, monthly, answers your questions. And then, of course, I'm sure you can only answer one, but I'm sure majority of you also review prior to submitting an FAQ. So our next question, do you participate in the Data Manager Collaborative? I think for our next survey, we'll need to update the language in this we're getting rid of the term mentor mentee. We're instead utilizing the peer-to-peer peer-to-peer for the Data Manager Collaborative. So but yes, thank you for those of you that do participate. I think we can go ahead and end this one, Nancy. So thank you. So yes, the majority are not participating in the program yet, but you're aware of it. Many of you are unaware of the program. And there's some information. The STS database news is going out later this afternoon, if it hasn't gone out already. And there is information in the STS database news about the Data Manager Collaborative. So feel free, be sure to check that out and learn more about the program. So it is Addie Dolan is in charge of that program, and it's very, I do encourage you to check it out and sign up for it. So it's, but please check it out and participate if you can. Next, if you do participate in the Data Manager Collaborative, how would you rate the overall experience? Very good, neutral, poor, I do not participate. And all of these responses do go back to Addie. So she is using this again as feedback to continue to improve the process and the program, as it is still in the newer phase of the program. So we encourage the feedback that, if you could provide any feedback, she's been extremely helpful or grateful for the feedback. All right, Nancy, I think we're good. So the majority do not participate, and then we have neutral, good, very good, and then poor. So our next for neutral or good, neutral, poor, or good, if there are any aspects of the program that could be improved, I believe you have the option to type in some feedback here. So I'll give you just a few moments to type in some quick feedback. If you have feedback and not enough time to put anything in, please feel free to just email me directly and I can share that with Addie. Okay, Nancy, I think we can go ahead and end this one. All right. Next, for those of you that do participate on average, how many hours per week do you commit to the program? All right, Nancy, I think we can go ahead and stop this one. So 1 hour or less, the majority do not participate again. All right. Next, are you familiar with the IQVIA Resource Library? Yes or no? Nancy, I think we can go ahead and stop this one. So, yeah, the majority of you are very familiar with the library, and then we have about 14% that are not quite familiar with the library just yet. Do you review the notifications in the IQVIA platform? Yes or no? All right, Nancy, I think we're good. So 69% of you do, about 31% of you do not. For those of you that do not, I would encourage you to check it, whenever you log in to the platform. Um, I see your comment there, Liz. It would be nice if they can email an alert when a notification is posted in IQVIA. I don't know if that's something that they can do, but we'll take that feedback to them. But I would encourage you, every time you log into the platform, go to the notifications. That's where we post our IQVIA post known issues. The platform is down. Please check that prior to submitting, a help desk ticket. All of those urgent, immediate notifications are posted there. Did any staff, we're going to talk about AQO now. Did any staff attend the STS Advances in Quality and Outcomes, the AQO conference? Yes or no? So did you attend AQO this past year? All right, Nancy. So 57% did not, and about 43% of you did. For those of you that did attend AQO, be it in person or virtual, did you find it useful? Okay, Nancy, so we're about 93% yes, and 7% said no. If you did not find it useful, please reach out to me. We'd love the feedback. Let us know what we can do to make it useful for you. If you attended the AQO Hot Topics webinar, did you find it helpful? think we're good. About 89% of you, yes, and 11% no. And then next, how likely are you to attend the AQO in-person meeting in 2025? I'll be there, maybe, not likely. All right, we can go ahead and end this one. So it's 43% not likely, 34 maybe, and 23% that will be there. All right, does your institution budget for data manager travel? Yes or no? Right, we're good. Let's see, about half and half, 51% no, they do not budget, and 49% yes. All right, next, which challenge do you face with in-person meetings the most? Budget affordability, the date, length of the meeting, or the location? All right, Nancy, I think we're good. So I'm not surprised, 80% budget affordability, followed up with location and then date and length of the meeting. And then our last question, who do you use for your electronic medical records? Do you use Epic, or Oracle Cerner, Meditech, NextGen, or other? Oh, wait, Nancy, I think we're good. Not surprising, the majority is Epic, followed up with Oracle Cerner, Meditech, and then other. All right, we've got just literally a couple of minutes left. Does anyone have any questions? If not, I just wanted to thank you all for hanging on and taking part of the survey. Angie had a question. I don't know if people are still on. How many use the long list for diagnosis and procedures? I don't know if you want to you could probably just give a thumbs up and use the react button. I don't know if for anyone that happens to use the long list for diagnosis and procedures. And for those of you that are not familiar with the long list, this is for cardio access users only. I know not everyone uses the long list, but it looks like a vast majority of the people that are responding looks like do use that long list. Wasn't able to get a quick count there, Angie, but looked like a pretty good response. Okay, question from Jim. What do you plan to do with the results? So after these results, Emily will take all of the survey results, put them into a PowerPoint presentation and post it out on the STS website. So you can download the results if you, want to share with anyone within your institution. But the results will be posted out on the STS website. Emily's out on vacation this week, so I would expect them to be posted within the next couple of weeks. And as always, here's my contact information, Carol Crohn's as well. Our database operational questions, if you have questions for billing, contracts, or contact updates, please reach out to STSDB. And then our help desk, as usual, for any and all issues related to the IQVIA database platform questions, submitting data, reports, passwords, all that fun stuff. Please reach out to the help desk. And as always, if you have clinical questions, submit those via the database FAQ. Was the AQO Hot Topics recorded? If so, where to find? So yes, Janet, if you participated, if you attended AQO, the Hot Topics webinar was recorded and it's out on the education page. It's out on the page with the with the other AQO content. If you want to just send me an email directly, I can send you a link. If you, again, that's if you attended AQO, you would have access to that information. All right. No problem, Janet. Well, that's all that I have. Again, thank you everyone for taking the time to complete the survey today. We are extremely grateful. So if you have any questions, please feel free to reach out and we'll see you on our next monthly webinar. Thanks, everyone.